Hi there, my name is Kate Engelbrecht, and I'm here with Michelle Moran to present to you H.R. 4981, the Opioid Use Disorder Treatment Expansion and Modernization Act. The goal of this particular bill is to improve and reform the treatment for opioid use disorder, an epidemic that is currently sweeping our nation. H.R. 4981 would permit nurse practitioners and physician assistants to apply for waivers, which would allow them to prescribe buprenorphine products to patients who struggle with opioid dependency. Additionally, the bill would allow pharmacists to fill partial prescriptions for certain drugs upon the request of the prescribing physician or patient. H.R. 4981 was introduced to the House on April 18, 2016, by Representatives Dr. Larry Bucshon, a Republican from Indiana, and Paul Tonko, a Democrat from New York. On May 11, 2016, the bill was passed and agreed to in-house. The next day, on May 12, 2016, the bill was received in the Senate, read twice, and referred and introduced to the Committee on Health, Education, Labor, and Pensions. As far as additional bills that relate to H.R. 4981, there are a few that have very similar goals. There is H.R. 4599, which is the Reducing Unused Medications Act of 2016, H.R. 5289, the Opioid Abuse Crisis Act of 2016, and S. 524, the Comprehensive Addiction and Recovery Act of 2016. Dr. Bucshon, one of the representatives who introduced this opioid use disorder treatment bill, has a video on his YouTube channel in which he addresses and urges support for H.R. 4981. It is clear from watching his speech that Dr. Bucshon is very passionate about this cause, as he states that the opioid epidemic has left no area of this nation untouched. He also stresses that this epidemic is growing and will continue to grow unless immediate action is taken. Therefore, it is understood that through H.R. 4981, Congress aims to increase awareness and access to all treatment options for opioid use disorder, overdose reversal, and relapse prevention.
High numbers of opioid prescriptions and substance misuse play a role in the opioid crisis. 259 million opioid prescriptions were written in 2012, which was more than enough to give every American adult their own bottle of pills. Nearly 2 million Americans had a substance abuse disorder involving prescription pain relievers, and a prescription opioid pain medication was responsible for over half of the 38,000 overdose deaths in 2010. Young adults misuse opioids more frequently than other age groups, leading to over 1,700 medication overdose deaths among this population in 2014. Nearly 500,000 teenagers use pain medication for non-medical purposes, and 168,000 are addicted. Opioid misuse can affect accessibility and quality of care. For each prescription medication overdose death, there were 22 admissions and 119 emergency room visits. The opioid crisis is taking the availability of emergency health care services away from other patients in need. Providers are caught in the difficult situation of potentially undertreating someone with legitimate pain issues or writing an opioid prescription for someone looking to misuse the pills. Existing legislation limits the quantity of opioids physicians may prescribe and the number of patients they may see for opioid treatment. This bill expands to include nurse practitioners and physician assistants as qualified practitioners and allows raising maximum patient limits to 250. Expanding these constraints would allow more patients to be seen and treated, improving accessibility of care. The states of Kentucky and Florida have both passed opioid-related legislation with mainly positive outcomes. Kentucky's bill requires providers to perform a full history and physical, prescribe a limited supply of medication, and consult the state's prescription monitoring program. As a result, Kentucky had a 10% decrease in opioid prescriptions, and 61% of providers prescribed fewer opioids. But there was no significant decrease in opioid overdose deaths. Florida had a similar law and saw the opioid overdose death rate decline 27%.
Unfortunately, there are current laws which place several limits on the ability of healthcare providers to prescribe buprenorphine, a type of opioid given to abusers of opioids in hopes to treat their addiction. Buprenorphine administration is a component of what is known as MAT, medication-assisted treatment, which often includes intense medical and social services to help treat addiction. H.R. 4981 amends the Controlled Substances Act to expand access to medication-assisted opioid addiction treatment. It ensures patients who have access to a wider range of comprehensive, evidence-based treatment options and helps minimize the potential for drug diversion. The legislation is a product of months of stakeholder engagement, expert input, and bipartisan negotiation. The four main goals of this bill are therefore to increase access to opioid use disorder treatment where it is most needed, to empower physicians through education, training, and quality care measures, to encourage a multi-pronged approach to opioid use disorder treatment while deterring bad actors, and to take positive steps towards increasing access while also raising quality of care and reducing diversion.
Physicians and pharmacists may lose their licenses if they fail to comply with the provisions of the bill, as happened to 50 individuals in Ohio after a pill mill bill was passed. With a decline in available opioid medications, addicts may turn to heroin as less expensive alternatives. After Kentucky passed their opioid bill, 8 total heroin arrests in 2011 exploded into 160 in the first 6 months of 2013. An article in the Journal of American Medicine found that heroin-related deaths increased by 26% from 2013 to 2014 and have tripled since 2010. Increased rates of IV drug abuse could increase rates of HIV, hepatitis, and endocarditis infections from sharing needles.
The Congressional Budget Office, also called the CBO, estimates that enacting H.R. 4981 would reduce net direct spending by $37 million over the 10-year period from 2017 to 2026. The CBO's estimate is based on the assumption that H.R. 4981 will be enacted near the end of fiscal year 2016. Section 3 of the bill, which touches on the aspect of permitting NPs and PAs to prescribe buprenorphine, would increase direct spending by $85 million. Section 5, on the other hand, which focuses on allowing pharmacists to fill partial prescriptions, would decrease direct spending by $122 million. Overall, this warrants a decrease in net spending of $37 million over the 10-year period, which is of course a favorable outcome for this bill.
According to maplight.org, a website that reveals money's influence on politics, H.R. 4981 has support from 5 organizations of physicians and other health practitioners, mental health services, and health and welfare policymakers. Supporters include AIDS United, American Academy of Family Physicians, American Academy of Physician Assistants, Community Anti-Drug Coalitions of America, and National Council for Behavioral Health. These groups gave an average of $21,691 to House members who voted yes on H.R. 4981. The American Society of Addiction Medicine opposed the bill and gave an average of $26,689 to House members who voted no. The president of ASAM approved of expanding prescribing authority to nurse practitioners and physician assistants, but disapproved of failing to raise patient caps on buprenorphine prescribing for physicians, which would increase access to treatment and prevent additional opioid overdose deaths. Pharmaceutical companies that manufacture opioids may oppose this act, as it could decrease their profits due to fewer prescription purchases. Patients who use opioids would have improved safety in their treatment plans, although some may not have their pain fully treated, or could turn to heroin if they are unable to receive prescription opioids. While this act adds to the efforts to address the opioid abuse crisis, several changes would improve the overall impact. Legislatures should add provisions in this act to limit the number of pills that each patient can receive and implement prescription monitoring programs to prevent patients from doctor and pharmacy shopping. Legislators should increase patient caps on buprenorphine prescribing as recommended by the ASAM before approving this act. This proposal will be successful as demonstrated by a decrease in opioid-related deaths and an increase in patients seeking counseling and opioid treatment programs.
That completes our presentation for today. We hope you enjoyed listening, and we hope you learned a lot about the Opioid Use Disorder Treatment Expansion and Modernization Act.